Obviously, growing up, I was in a very sporting family, and I was sports mad growing up. In fact, I found school to be a bit of a hindrance in my day, but it was something you had to do to get to play sport on the fields in the afternoon. So sport's always been a major part of my life. And interestingly, I always wanted to be a sports physio coming out of school. I wanted to be able to run onto the field and treat all these amazing sports stars every Saturday. But obviously, having such a keen interest on sport, I certainly wasn't going to be knocking all the A's out the roof when I got to matric. So unfortunately, I wasn't going to get into physio. But via a twist of fate and some life occurrences, I ended up defaulting to chiropractic. Studied my chiropractic, and I was overseas for quite a while, and ended up fortunately getting in to do a master's degree in sports medicine at Nottingham University. So that's where my sports physician qualification comes from. And I guess, right from a young age, sport has been a major part of my life. Always had a massive interest in it, a passion for it, and I guess that's now come through in my work. And absolutely have the passion of treating athletes, seeing them recover from injury, and better still, seeing them improve their performances through the use of chiropractic. So I'm a member at Johannesburg Country Club, and I love playing there when and if I can get on the course. I also got 2 young kids, so these days golf is a treat. Fortunately, my folks live down in George, so I get to play some of the George courses fairly frequently, which is also a treat. But probably if I get away with 3 or 4 rounds a year, I've done well. Obviously, as the kids grow up, I'm hoping to get back out there. Yeah, look, I think you're dead right there. There are a lot of misconceptions on what chiropractic is and what we do. Certainly our profession's come a hell of a long way from the good old Rick and Plick doctor that everybody used to refer to. One of the biggest misconceptions I get is that we click. I just click this, just click that, and miraculously I feel better. Chiropractic is the Greek term for done by hand. We're educated as primary contact practitioners. So in essence, anybody can come into our offices off the street and we should be able to examine them. If it's a chiropractic case, obviously treat them. If it's not, we actually have the education through diagnostics to be able to say, you need to go and see a specialist or a GP or a physio or whoever else needs to come to the party. The chiropractic itself, obviously we specialize in the spine, and our focus really is on the health of the efficiency of the communication of the nervous system. The nervous system is encased within, peripheral nervous system is encased within the vertebral column, and that's our go-to. We'll sort of check the spine, see the movement and the health of the spine, and try and remove any inhibitions or restrictions or dysfunction that might be inhibiting the nervous system. The basis of our philosophy is that if you have a healthy functioning nervous system, you essentially have a healthy functioning body. If the brain is able to communicate with every tissue in your body, essentially there's no reason why you should be sick or get injured. That would obviously be a perfect world, but we work within those realms. Our biggest tool, or our main tool, is manipulation. Obviously there's a lot of skepticism about manipulation, and unfortunately a lot of the research that's out there is done on the broad scope of manipulation. It's not necessarily done on chiropractic manipulation. Chiropractors will pride themselves in having been educated and specialized in a very short amplitude, high velocity specific manipulation, which is the difference. A lot of the manipulation you might get from other professions tends to be long lever type manipulation, which has its risks because it's not specific enough and potentially could cause some damage. That's not to say that the short amplitude stuff doesn't come with its risks, but they're certainly a hell of a lot less than the long lever type of manipulation that might commonly be used. So chiropractic is very focused on the spine, very specifically orientated towards manipulating a specific segment which would be related to your injury or problem. And our goal really is to try and restore function and normal movement, not only to the joint and the spine, but also to the nervous system, to hopefully restore health and restore function. I do enjoy reading books. I do wish I had the time to read a bit more. As I've mentioned, I've got 2 little kids, so if I'm not in the office, I'm rushing home to spend some quality time with them. They're getting to age now where they're also getting into their sport. So daddy's playing cricket and tennis when he gets home from work, which is great, and I love that. And that really is filling up a lot of my time these days. I'm still quite involved with our National Chiropractic Association, these days more on a sort of consultation sort of basis. And I'm very, very involved with our International Chiropractic Sports Federation, making connections with international sporting federations and getting chiropractors placed within those sports teams to treat their athletes, to keep them on the field of play and also to enhance their performances.